This is how we do brain surgery for a hemorrhage. Depending on the location of the bleed, the patient is positioned. Their head is likely attached to a skull clamp to keep their head fixated to the bed. A large question mark shaped incision can be made to expose the skull, at which point we place boreholes into the skull. We then use a specialized drill to be able to remove a portion of the skull so that we can gain access to the brain. And once we remove the portion of the skull, we're then able to visualize the covering of the brain. Leave a comment if you know the name of it. If the patient has an epidural hemorrhage, we will likely be able to visualize it right underneath the skull without the need to open up the cover. But if the patient has a subdural hemorrhage, we'll need to open up this membrane and gain access to the actual brain tissue. We will try to evacuate as much of the blood as possible and decompress the brain. Once this is done, we will then reapproximate the edges of the protective membrane. And typically we would place a collagen material on top of this protective cover in order to allow it to heal properly. The skull is then placed back onto the head and secured in place with titanium plates, at which point we will then reapproximate the skin edges and close the incision. There are some instances where the skull can be left off of the patient. This can be done when there's a significant amount of brain swelling. And if that is done, the patient will be given some time to recover, at which point they will be brought back to the OR where the bone flap will then be replaced. And now you know how to do brain surgery.